Hello, everyone. Trying to adjust this height-wise. It's a bit of a challenge, as we saw in the morning. So I work for an organization called Tiko, and I'm just going to share with you a little bit about Tiko's contribution using our digital technology in terms of serving adolescents and young people and supporting them to access sexual and reproductive health and HIV services. So in just listening to the session in the morning, Dr. Nyarazzo really painted the picture of the challenge that young people find themselves in, rather the health outcomes that face adolescents and young people within the region. So without belaboring the point, I think what is happening with Tiko is that we are trying to make a contribution in addressing some of these health outcomes. So examples being supporting adolescents and young people address issues of unintended pregnancies, HIV infections, sexual and gender-based violence cases. But to start off, who exactly is Tiko? We are a non-profit African-based organization that leverages the power of technology to respond to the needs of adolescents and young people, particularly around SRH and HIV. So Tiko uses a tech-powered model that connects different players that would otherwise be fragmented. So create a platform that brings various players together, and this just enables young people to have an easy time accessing sexual and reproductive health services at no cost. Our model, therefore, because it brings these players together and we support young people to access health services at no cost, it therefore removes some of the barriers that young people face in their quest to access sexual and reproductive health and HIV services. Some of those barriers include social barriers, be it social norms, lack of knowledge and awareness, and so on, but also financial barriers. And so ultimately, by removing these barriers, Tiko is able to empower young people to take charge of their lives. So it gives them agency to take charge of their lives. We work in 6 countries across the Sub-Saharan Africa region, and our main focus is usually in the urban and peri-urban areas of these countries. We've got a unique approach, therefore, in terms of our, how we structure our approach to serving adolescents and young people. So the first thing, of course, is we try and remove the barriers that young people face in seeking to access sexual and reproductive health services. Our focus for young people is those aged 15 to 24 years, and we do this, we try and remove the barriers that they face by, through that connection that we make, by ensuring that young people, health providers, have a platform that they're able to come together. So young people have therefore an ability to choose from this range of health providers the one they want to visit based on their need. They can access public health facilities, they can access private facilities and pharmacies. And Tiko does support access to various health services, including sexual and reproductive health services, so mainly contraceptives, HIV services, testing, pre-exposure prophylaxis, ART, sexual and gender-based violence, menstrual health, and mental health. And the other thing that Tiko does is supporting young people to make informed decisions. We do this through a number of approaches. Number one is we support by providing these adolescents and young people with relevant information based on the service offerings that Tiko supports. So we work with community mobilizers and community health workers to provide these young people with information about available health services, where they can seek these services, and the fact that they can access them free of charge. We use behavioral nudges, so as a form of behavior change, as Dr. Ben Bellows has just articulated, to try and really motivate them to access FP, access HIV testing, and stick to those health services to guarantee their health outcomes. We use electronic vouchers that really make it easy for young people to access these services, appreciating that not all of the young people that we work with will have access to a mobile phone or digital technology, so we have a solution to that in terms of electronic vouchers. And therefore, the platform as well enables us to collect real-time data. And this real-time data helps Tiko to be able to, in real time, monitor access to services and take remedial actions to improve just how young people are accessing services, just to guarantee their health outcomes. So what does the Tiko platform comprise? It has about 5 key players. At the center of it, we have the young person themselves. And this young person gets introduced to the Tiko platform by a community mobilizer. This mobilizer will provide them the information, and then they will link them or direct them to a facility or a range of facilities that are engaging with Tiko. And so based on their need, they are able to choose the provider they'd like to visit. Now, as a form of encouraging behavior change, we do some rewards. So, and I was quite excited to see Dr. Bello's presentation highlighting rewards and threats as one of the key, focus areas if you want to influence behavior. So Tiko does provide small incentives to these young people when they access services. And they can redeem these rewards, which we call Tiko Miles, in participating local retailers who are situated in the communities that these young people live in. And we are able to do this, of course, with support from our donors, hence the ability to provide free or subsidized services to young people. So in essence, Tiko connects different players and partners across demand and supply chain. We generate impact through donor funding, and we are able to influence behavior for adolescents and young people. Now, because of the real-time nature of our Tiko platform, so how does this exactly work? We have, when the community mobilizers and the community health workers engage young people, they introduce them to the Tiko platform. So the platform allows us to be able to create that linkage. The platform also validates every engagement that young people are having on the platform, be it at the point of registration with the community mobilizer or community health worker, or when they are engaging with a service provider. So an example is, assume they registered on the platform with their mobile phone, when they have made a choice of the service they want to access, Tiko allows them to send a trigger code to the cloud-based system, and the cloud-based system in turn responds back to the young person with a code. If they are with a provider, they are able to give the code to a provider who inserts it into an app, the Tiko app that the provider uses. So that kind of back and forth validates that a service has been had, or helps Tiko to collect some crucial information about these young people. We are able, for example, to collect information about the age of the young person, their gender, their location, but critically as well, the service they've taken and where they've taken the service. So we refer to this back and forth process as a digital handshake, because without one of the players in this process completing an action, we wouldn't be able to collect the data points that we collect at the back end of the Tiko system. It also ensures that the data that is collected at the back end is accurate. So then we are able to work with accurate information in the decisions that we make. With the real-time data, we are able to visualize that information through dashboards, and we ensure that key players within our programs have access to these dashboards. So we will have our program implementers having access to the dashboards, our partners in the ministries, our donors, and other players that we engage with having access to these dashboards, including the health providers. Now, because the data is real-time, they are able to quickly observe, monitor the data, the services being accessed, and take actions really just to maximize the benefits and the impact that Tiko can have for young people. And so as I complete, I just want to share some of the impact Tiko has been able to make as a result of this digital platform. From January 2020 to August 2024, we've been able to reach 1.5 million young people across the 6 countries that we work in. And we've been able to provide just under 3 million services. And because we work with quality assured service providers, we have more than 600 that are engaging with Tiko. So at Tiko, we are quite proud of our support for the health needs of adolescents and young people in the region. Thank you.